Welcome back to today's health program. Today we're going to explore a very important topic, pneumonia. This is not just a medical term, but a serious illness that many of us may not fully understand. Pneumonia is an infection of the lungs, usually caused by bacteria, viruses, or fungi. In fact, pneumonia is one of the leading causes of death globally, especially affecting vulnerable groups such as children under 5 years old and the elderly. In today's program, we will learn more about this disease. What is pneumonia? What causes this condition? What dangerous health complications can it cause? Most importantly, we will discuss effective measures to protect yourself and your family from this dangerous disease. Follow along to equip yourself with the necessary knowledge to help improve your health and prevent disease in the best way. Pneumonia is a serious condition that involves infection in the small air sacs inside the lungs, called alveoli. When the body becomes infected, these alveoli become inflamed and can fill with pus, reducing the body's ability to exchange gases. This not only makes it difficult to breathe, but also affects the body's ability to deliver oxygen to cells and remove carbon dioxide, leading to many serious health problems. The causes of pneumonia are many and varied. Among them, bacteria such as Streptococcus pneumonia are considered the leading cause of this condition. In addition, some viruses such as influenza virus, respiratory syncytial virus, RSV, and especially coronavirus can also cause pneumonia. Each of these pathogens has a different way of spreading and affecting human health. Bacterial pneumonia is usually more serious, requires prompt medical intervention, and is usually treated with antibiotics to kill the bacteria. In contrast, viral pneumonia is usually milder, but if not properly diagnosed and treated, it can still lead to dangerous complications such as respiratory failure or bacterial superinfection. Therefore, it is very important to be aware of and understand the types of pneumonia to be able to protect the health of yourself and your family in the most effective way. Pneumonia is mainly spread through tiny droplets containing bacteria or viruses, which are released into the environment when an infected person coughs, sneezes, or even talks loudly. These droplets are very small in size, can float in the air for a certain period of time, and they can also easily stick to surrounding surfaces such as doorknobs, tables and chairs, or other everyday objects that people often come into contact with. The route of infection of pneumonia often occurs when a healthy person accidentally inhales these droplets containing pathogens when near a sick person or in poorly ventilated spaces. In addition, indirect contact also plays an important role. If your hands touch surfaces that have been contaminated with bacteria or viruses, such as desks, phones, doorknobs, and then put your hands on your eyes, nose, or mouth without washing your hands thoroughly, bacteria and viruses can easily enter your body, causing pneumonia. In particular, enclosed spaces such as meeting rooms, classrooms, public transport, or crowded areas such as restaurants and shopping malls are places where bacteria and viruses can easily spread. In these environments, air circulation is limited, creating favorable conditions for pathogens to spread quickly from sick people to healthy people. Those at highest risk of pneumonia are those with weakened immune systems. Children, especially those under 5 years of age, often have not yet fully developed the ability to fight off pathogens. The elderly, whose immune systems decline with age, are also more susceptible to pneumonia. In addition, people with chronic diseases such as diabetes, cardiovascular disease, chronic lung disease, or those who are being treated with immunosuppressive drugs are also at high risk. They are not only susceptible to the disease, but also at risk of serious complications from pneumonia, requiring timely care and treatment. Understanding the transmission mechanism and awareness of the risk of infection is extremely important in order to be able to take effective preventive measures to protect the health of yourself and the community. The symptoms of pneumonia are often easily confused with the flu or other common respiratory illnesses, causing the patient to be subjective and not realize the severity of the disease. However, there are some typical signs that you need to pay special attention to. One of the most obvious symptoms is a persistent cough, which may be accompanied by phlegm. Phlegm in pneumonia is often yellow, green, or even mixed with blood, which is a sign that the infection in the lungs is serious. In addition, the patient often has a high fever, which may be accompanied by chills and sweating, especially at night. Difficulty breathing is another common symptom when the patient feels a heavy chest and has difficulty taking deep breaths. Sometimes, each time the patient takes a deep breath or coughs, the patient also feels pain in the chest, which comes from inflammation and tension in the lungs. Not only stopping at physical symptoms, pneumonia also affects the general state of the body. Patients may feel tired, exhausted, and have no appetite, leading to rapid deterioration. Especially in the elderly, in addition to the usual signs, pneumonia can also cause mental symptoms, such as confusion or cognitive changes. This makes pneumonia in the elderly more dangerous because mental changes can be overlooked or mistaken for other problems related to old age. If you or a loved one has the above symptoms, especially when in contact with a sick person or has just experienced the flu, pay attention and see a doctor immediately. If pneumonia is not detected and treated promptly, it can lead to dangerous complications, especially in people with weakened immune systems, such as young children, the elderly, or people with underlying medical conditions. Early diagnosis and timely treatment will help prevent the disease from becoming severe and protect health effectively. Certain groups of people are at higher risk of pneumonia, especially those with weakened immune systems or vulnerable lungs. Children under 5 years old and the elderly over 65 years old are the two groups most susceptible to pneumonia. Young children do not have a complete immune system, while the elderly have a weakened immune system over time, increasing the risk of infection. Pregnant women are also at high risk due to the decline in immunity during pregnancy, which can affect both mother and fetus. People with underlying diseases such as diabetes, cardiovascular disease, or cancer are also at high risk of pneumonia. These diseases reduce the body's resistance, making it more difficult to fight pathogens. In addition, people who smoke or are frequently exposed to polluted environments are also susceptible to pneumonia. Cigarette smoke and polluted air damage the lungs, reducing the natural defenses of the respiratory system, making the lungs susceptible to bacteria and viruses. These groups need special precautions, such as vaccination and good hygiene, to reduce their risk of disease. Prevention is always better than cure. The most effective way to prevent pneumonia is to get vaccinated, especially against pneumococcal and influenza, the main causes of pneumonia. In addition, maintaining personal hygiene is very important. Wash your hands regularly with soap, especially after touching public surfaces. Wear a mask when going out or in crowded places, and keep a safe distance from people who show signs of infection. A healthy lifestyle, including a nutritious diet, regular exercise, and not smoking, also helps to strengthen your immune system, helping your body to better prevent disease. Treatment for pneumonia depends on the cause. Bacterial pneumonia is usually treated with antibiotics, while viral pneumonia requires antiviral drugs or symptomatic treatment. Depending on the severity of the disease, patients may need to be hospitalized for intensive care, especially if they have difficulty breathing or complications. It is important not to self-medicate or stop treatment, as this can lead to antibiotic resistance, making treatment more difficult. Protecting your health is not only a personal responsibility, but also a responsibility to the community. Pneumonia can spread quickly, especially in a collective environment. Therefore, it is extremely important to comply with preventive measures. We are not only protecting ourselves, but also contributing to protecting those around us, especially those who are most vulnerable. Thank you for taking the time to watch. Always take care of your health and your family's health to build a healthier and safer community together.